In today's session, we're going to hear a little bit about everything on the topic of acute stroke. We're going to talk a little bit of dissection, about stenting on the intracranial vessels, extracranial access, what access should you perform, what you're looking for when treating these patients. I'll be focusing on AI-based decision-making. I'll be talking about the ethical problems, who it might help, how it works, about the development of the AI-based decision-making on interventional radiology.
Today's session is very exciting. It's new developments in interventional oncology, lots of exciting new things that are just becoming approved, that are becoming more prevalent in cancer therapy. My talk is on histotripsy of liver cancer, which is very exciting. Last year I presented the new phase 1 clinical trial data at CIRSE, and this year, now that it's FDA approved in the US, there are multiple centers internationally using histotripsy. We have a lot more data. We have data on the abscopal response, which I know people are very excited to hear about. So I look forward to presenting.
In today's session, we'll be talking about BEST CLI and the Basel III trials. These are two of the most sort of prominent clinical trials looking at the outcomes of peripheral artery intervention in CLTI patients. And I'll try and see how we can apply the findings in a real-world setting, because everybody's practice is different, our patients are different, and the healthcare systems we work in are also quite different. And I think it'll be a good opportunity to encourage debate. It'll be interesting to hear some of the questions that arise from the audience, so I'm looking forward to a lively session.
Today's session on erectile dysfunction is a very special session, not only to us, because it's the first time that we have a dedicated session at CIRSE on erectile dysfunction. There are two causes of vascular erectile dysfunction. One is arterial obstruction, so you have a reduced inflow, and the other one is venous leak, so you have an increased outflow into the veins. So in my talk, I will explain on the venous leak and explain on the diagnosis and treatment of venous leak, including videos and including also technical aspects for the procedure. And we will also discuss the clinical results.
In today's session, I believe this is a very nice and interesting session that will include a wide range of interventional procedures focused on pulmonary and thoracic conditions in pediatric patients. My particular presentation will be focused on the endovascular management of hemoptysis in children, and I will share with the audience some very interesting and didactic cases that I hope that will give some tips, some practical tips to incorporate in their practice.
As you know, at Boston Scientific, we have a pretty broad portfolio. We do believe a lot in drug-eluting technologies to improve the treatment of peripheral artery disease patients, especially with the Eluvia stents. And this year specifically, in addition to our body of clinical evidence, we will be sharing cases so that people can understand what is actually an Eluvia patient, an Eluvia case. And you will see that in our case-based discussion in the main program, as well as on the booth here with our real case simulation. On the interventional oncology side, we will be focusing a lot on TheraSphere and how we can use TheraSphere in combination with immunotherapy. A lot of potential there. And finally, for cryoablation, you know it's a very well-established indication for kidney cancer. But this year specifically, we'll be exploring new indications for women's health, especially, that are developing, specifically endometriosis as well as breast cancer.